Ahmaud Arbery, George Floyd, Breonna Taylor, all three African Americans who have been unjustly shot or unjustly killed, reiterating the stories of racism in the United States of America. Hence, the constant bombardment of pictures, videos, and petitions throughout our social media from around the world, standing up for the neglected ones and, most importantly, wanting change, especially in the law enforcement. However, within all of these pictures and videos, there is something that many disregard and is often overlooked. That there is also racism in a field where supposedly all people are equal, no matter what gender, race, religion, etc. you are. That you'll be treated equally and fairly. In a field where doctors and nurses are sworn to do no harm, but that is not the case, sadly. There is, in fact, racism in medicine. Hello, my name is Sara Razavi, and some basic information about myself is that I live in Vienna, Virginia. I go to Oakton High School, and some of the extracurriculars that I do are robotics, tutoring, as well as a volunteer at my local hospital. And in terms of my career, I'm very interested in the medical field. So moving on. Why is addressing racism in medicine such an important topic, and why should it be addressed in a global health leadership conference? Well, in the country of the land of the free and home of the brave, a country that has been built upon 250 years of slavery, 90 years of Jim Crow, and 60 years of inequality, it has produced a legacy of racism, hatred, and injustice that has been running from 1619 to the present. And in response to this hatred, lives are cut short. According to the CDC, Black women are 3 to 4 times more likely to die in relation with pregnancy or childbirth than a white woman. Black men have a 50% higher premature mortality than white men. Black babies have 3 times the chance of death in its first year than white babies, and in every 7 minutes, a Black person dies prematurely in the United States of America alone. So after you do your calculations, that means that in a single day, over 200 Black people die. So in general, overall, Black people have higher rates of morbidity and mortality than white people for most indicators of physical health. And although there might be several factors that could be attributed with this, such as economical and environmental factors, like not having a good health care plan, studies have shown that minority patients tend to receive lower quality of care than non-minorities, even when they have the same types of health insurance or the same ability to pay for care. So how did this happen? Similarly to how doctors look into their patients' medical history to treat their patients, we too have to do the same in order to understand how racism came to be in medicine. So if we were to look into history, we could argue that it started during European colonization, but I'd like to take a few steps forward, and that it actually happened during the time when slavery was very dominant in America. When slaves were used from physicians as a way to improve their medical care and medical research. And even after the slaves were freed after the Civil War, it never ended there. One of the most profound examples was during 1932 at Macon County, a time where there was no known treatment for syphilis. So you see, at this time, African-American men who had syphilis were promised free medical care, free meals, free physicals, and free burial insurance if they were to be enrolled in a project. What they did not know was that this project would be a study of the progression of syphilis without treatment among the African-American men. So in hopes to be treated, instead of the recommended treatment, which is penicillin at the time for their syphilis, they were given of placebos like aspirin and mineral supplements. And so this resulted in many of the African-American men dying, going blind, going insane, or other health problems due to their untreated syphilis. And this is the profound Tuskegee syphilis study, a study in which Associated Press reporter John Heller said, one of the grossest violations of human rights I can imagine. So you see, these experiences range from Black people going to the hospital expecting to be treated for, but only to become subjects to a radiation experiment, or to little Black boys having parts of their brains cut off because of some behavior disorders. These experiences have thus created, as the author of Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present, Harriet A. Washington says, as a shadowy culture among African Americans, where fear of medical research and fear of medical care is very predominant. That means that iatrophobia, which means fear of the healer, is very common among the African American community, which explains the reasoning as to why many of the African Americans that we see today are very hesitant to go to the hospital when wanting treatment for whatever they're dealing with. However, racism is such a complex and multidimensional problem that it's hard to pinpoint at exactly one specific thing. It could range from being the patient's fault to the physician's and to the system's fault. But one of the most dangerous ones is implicit bias, which means an unconscious attribution of particular qualities to a member of a social group or class of people, which is very astonishing. But it makes it even more important to find a solution for this problem, knowing that by 2050, in America only, people of color will represent most of the US population. And currently, over 37 million individuals living in the United States are identified as Black or African American, comprising the third largest racial or ethnic group. So we as a community, as a global community, must strive to find a solution for this, especially when this problem is so prominent. And one of the ways, the first steps to doing so is raising awareness about this issue, especially knowing that according to the Harvard Gazette, many people in recent polls deny the issues of racism in America. So because of that, we all must take a role in raising awareness about this. As Joseph V. Saccharon, Director of Emergency General Surgery and Trauma Surgeon in Johns Hopkins Hospital, says, racial injustice will only change if each and every one of us take on a shared responsibility. And so, as the end of my presentation draws near, I would like to end with a quote from MLK Jr. He said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. This is the reason why we, as the future global health leaders in medicine, must strive to reduce racism in medicine as much as possible. And the first step to do so, to make real change, is to raise awareness about racism in medicine. Not just racism in law enforcement, although that is very important, but racism in medicine as well." And so with that, these are my works cited. And now I would like to personally thank my parents for making sure that I always strive to do the best in whatever shape and form I do, and to push me in stuff that I never imagined that I'd be doing. And also I would like to thank the JHLC at JHU team for giving me this opportunity to express the importance of resolving and solving racism in medicine. So thank you very much.